Paperwork with perinatal loss is often the most frustrating part of looking after a loss patient. And the reason it is so complicated is because it is governed by laws in our country, both with the Federal Statistics Canada and also provincially with the Vital Statistics Act of Saskatchewan and also the Funeral Services Act of Saskatchewan. Let's go over the definitions and how we're going to classify these losses. So the definition of a miscarriage is the pregnancy at the time of delivery is less than 20 weeks and the weight of the fetus is less than 500 grams. So the key word here is and, it has to be both. And it's the gestation of the pregnancy, not the gestation of the fetus or the estimation of when the fetus has expired. There are many of these that happen in Emerge and in healthcare centers across the province. They are not registerable, meaning you do not have to notify Vital Statistics Saskatchewan of these losses. There is no provincial paperwork to fill out. There is local paperwork to fill out, but not provincial. Definition of a stillbirth then is at the time of delivery, the gestation of the pregnancy is 20 or more completed weeks, or the weight of the fetus is 500 grams or more. At this point, the fetus is looking more like a fetus. It's measuring maybe 10 centimeters by 5 centimeters or more. And it's past the point where you can just call it products of conception. So this is a human life. We really need to classify it as a stillbirth. And in this case, a Vital Statistics Act of Saskatchewan form is required. No signs of life at birth, or we know that he expired. Definition of a live birth then is any birth of any gestation showing any signs of life. This could be breathing movements, up and down movement of the chest, could be beating of the heart, could be voluntary muscle movement. So it doesn't matter the weight or gestation. We need to register this birth as a live birth. And what we need to remember, and I've written this into the work standard, is these are not obstetrical definitions. Obstetrical definitions differ from what Vital Statistics Saskatchewan is looking for. And we need to adhere by these guidelines and fill out the proper forms in the proper circumstances as much as possible. So our actions are congruent with the Ministry of Health and Vital Statistics. Neonatal death is a fetus born weighing 500 grams or more that dies within 28 days of life. This could be on our unit. This could be in neonatal intensive care. This could be in the periphery, a baby dying at home of SIDS maybe within 28 days of life. Now that we understand how we're going to classify the birth, let's look at the two Vital Statistics forms that you may be unfamiliar with. So the one on the left is the registration of stillbirth. So that's the birth of a fetus over 20 weeks or over 500 grams. That's just the one form you have to fill out. If the baby was born alive, the family would fill out the regular registration of live birth, and then the physician would fill out the form on the right, the medical certificate of death. And this is the same medical certificate of death that is used for any patient death in the hospital. And what these forms do is legitimize the death. A physician has signed off on the death saying that this in fact did occur. It wasn't a suspicious death or foul play or investigation for murder or anything like that. So there are two binders that are sort of brown in color. They're called perinatal loss binders. You will most often find them located in the loss room or anywhere on the unit where there's been a loss. The work standard that's in this binder is also located on SharePoint, but there's handouts in this binder and additional information that's not included in the work standard. So find the binder, pull it out, use it to guide your care. The work standard, body of the work standard takes you through the whole process from start to finish to discharge. And then the appendices, there are several, will help you guide your care of what types of forms to use and what to do with the forms. And so this is just showing you on SharePoint under policies and work standards, there is a separate category for perinatal loss, and that's where you will find the work standard. Appendix A of the work standard is the exact birth classification definitions that I've just given you, as well as the note that says these are not obstetrical classifications, which may differ. These are classifications reportable to Vital Statistics Saskatchewan, as well as the references for where I'm getting this information. Appendix B is what you're going to pull a copy out of the perinatal loss binder, and you're going to put it on your clipboard and use it as a worksheet. There are 4 columns. The columns are organized according to birth classification. So if you have a miscarriage, you're going to follow all of the steps and identify all of the pieces of paper found within the miscarriage column. If it's a stillbirth, you're going to make sure all your paperwork in the stillbirth column is complete. Same thing for live birth, neonatal death. And then the last column on the right, if you go across the page, it will tell you where to send that piece of paper. So for example, second row, it says genetics requisitions. If you follow that line over to the right-hand side, it says that you send this piece of paper to the cytogenetics lab, and the instructions are located in Appendix C of the work standard. So please use this as a worksheet, but keep in mind your documentation of care does not go on this worksheet. It all goes into ISP because ISP is the legal document. Appendix C is genetic testing instructions. These samples are very precious. It could be cord blood, it could be a piece of tissue, but we only have one chance to collect and process the specimen because it is a lost baby. So please follow the instructions very carefully as to what type of test tube do I use? Do I store it in the fridge? Do I put it in a container with saline? Where do I send the specimen? Follow the chart very carefully. And if you are unsure, you can always call an educator, or you can call the cytogenetics lab for further instructions. Appendix D describes the burial options that are available to the family, and I will go over these in detail. It's good to have an understanding of what options are available to the family so you can describe what these options are. There is also a pamphlet. Sometimes it's printed on purple paper, sometimes it's printed on white, but it is a pamphlet describing what the burial and cremation options are for the families. This pamphlet was written by Saskatoon Funeral Home, so it is sort of written from their perspective. Keep in mind that these patients are in crisis, they're exhausted, and they may not be retaining or absorbing any information you give them. So you may need to go over this information as to what their options are more than once. Appendix E is pricing options for the various options for burial. So for example, if they want to get an individual plot at Woodlawn Cemetery, the fee for that, both purchasing the plot and opening and closing it, it starts at around $350. These prices are 2 years old already, and headstones start at $600 or more dollars. So if your family has financial barriers, then the option that they should go with is hospital assisted cremation of the remains and interment in the shared garden, because Saskatoon Funeral Home provides us that service for no cost. The Appendix F is only required if the baby was a live birth, and what this form is doing is sending You're going to fill this out, slip it under my office door, and we will email Vital Statistics Saskatchewan saying that this is a deceased baby and please do not send a health card to this family. Appendix G is a list of funeral homes and crematorium services across the province. Like I mentioned in previous presentations, families don't expect this to happen to them. They may have no idea what their options are or what funeral homes are available to them in their area. So this is just to give them an idea of what are some funeral homes in their area. Like I said, these families are in crisis and may not even be capable of doing a Google search for themselves. So it's nice to have a piece of paper in your hand. Moving on to ISP, if you go to the discharge tab, and again, the discharge sub tab, if you scroll all the way down on the right-hand side, you're going to come across the perinatal loss task list. You need to document the care that you've given to this family here, such as, did you observe or help them to observe any religious or cultural practices? Did you consult social work? Did you make memory items with them? Did you take photos? Did you give them information on grief? So care not documented is considered care not done. So please document the things that you have done for this family. As much information as possible is better so that if we have to go back and look at it in retrospect, I can have a good idea of what went on and what you did for this family. Below that column, and I've zoomed in here, you are going to find form checklists, and it's organized according to birth classification. So miscarriage form checklist, stillbirth form checklist. I've zoomed in on the stillbirth. So this is exactly what the worksheet has on it for what to do with all the pieces of paper, except the worksheet is not a legal document. So you're going to document what you did with each of these pieces of paper on the forms checklist on ISP. Forms on demand packet. There is a loss packet. If you're admitting a loss patient, just tell the UA to print a loss packet. I'm going to go over some forms that you may not be familiar with. Some of the forms, such as the allergy intolerance form, are the same forms that you've used all the time. The consent for autopsy is a 2-page document. The physician needs to take consent for autopsy, but the RN can witness the signature. On the second page is information given to the pathologist about details about the birth and what exactly he's looking for. What did the baby present like on delivery? Maybe there was a knot in the cord. Maybe there was a lot of blood in the uterus. The more information we can give the pathologist about the delivery, the better his investigation is going to be. And the physician's signature is on the second page. The original copy of this form is going to go down to the autopsy suite, and if the baby is going for an autopsy, and wait there for the autopsy to be complete. You're going to put a copy of this in the patient chart. Cremation and interment authorization. The form on the left is what you're going to find in the loss packet that we print off forms on demand. This document is owned by the Saskatoon Funeral Home, and it is the parents consenting to have their baby cremated. I'll give you a warning that this process is currently under review, and the form that you see on the right-hand side is having to be filled out as well. And we will give you more updates as this becomes available. Key factors here: the mother and father need to fill out both their particulars if they're involved, and the nurse needs to sign at the bottom as well. Cremation is an important decision that cannot be undone, so we want to make sure that it is what the family wants and that the Saskatoon Funeral Home has all the information they need to comply with the law and the regulations in the province. After death logbook is a summary of everything we've done for this patient, and it does serve as a final checklist. So fill out this piece of paper as you go. I'll go through some details on this form as we continue on here. Let's talk about a live birth. So if the baby is born alive, you will fill out the maternal services newborn admission form like you do for every other baby, and you will fax that to registration. And what that will do is create the baby a health card number. It will have a file in hospital records, and there will be stickers issued for this baby. If the baby is born alive, you are also going to create a newborn in ISP. That's the additional work that needs to be done if the baby is born alive. The most responsible physician in this circumstance is the obstetrician who attended the delivery, because this infant is not expected to survive, and this is the only time when an obstetrician will be an MRP for a newborn. Monitor for signs of life and time of death. Assign APGARs if he lives for more than 1 minute and 5 minutes. Make sure to clearly document time of death in the newborn chart and in the maternal chart. One other thing that needs to be done if a baby is born alive is he's going to be created as a patient in the hospital, but then we need to ensure that he is documented as expired and removed out of the hospital records. So on your worksheet of things that you need to do includes asking the UA to discharge the baby from all scripts patient flow and document that the patient has expired. I've already mentioned this form. This is to ensure that a health card is not sent to the family. You're going to fill this out and slip it under the educator door, and I will email eHealth Saskatchewan. Going back to the after death logbook, if the baby has been named, we want to make sure that the name and the gender on the after death logbook matches with the form on the right, whether that's the stillbirth form like you see here or the medical certificate of death. It can be very hard to determine gender on a very low gestation fetus, 18, 19, 20 weeks, but you and the physician need to agree on a gender, document it the same in both places, and document the names the same in both places so that there's no discrepancies when the funeral home comes to be involved. Adding stickers to the after death logbook, you are going to put a mom sticker on the top right hand side like you do for every other piece of paper. And if the baby is a miscarriage or stillbirth, then that one sticker is sufficient. However, if he is born alive, he or she, then you would add a baby sticker as well to this form. Let's talk about what are the family's options for what to do with the remains of this baby. So we have a special program partnership with the Saskatoon Funeral Home in which they do cremation of any of our babies at no cost. And so the first choice that the families need to make is, do you want cremation or not cremation? Some families do not want cremation. It's not in their culture. So that's a different discussion. But first, we'll discuss cremation. So if the family wants cremation, then you've got 3 options for what to do with the ashes. Number 1, the ashes can be put in a shared garden at Woodlawn Cemetery. And this is where the ashes of all the lost babies go. Again, no cost for this. There is a monument at this shared garden that you have the option to put a little inscription on it. As well, there is a memorial service once a year for all these babies that the family has the option to attend. As far as being present for the interment of these ashes, the family does not have that option. In this circumstance, the funeral home spreads the ashes at their convenience. The second option is for the family to take the ashes home, so pick them up. They would need a little urn, and honestly, it's not a lot of ashes. It's a couple tablespoons, but they would need a little container to put those ashes in. And then at that point, they can do whatever they like with the ashes. You can spread ashes in more places, such as in your backyard. You cannot bury human remains in a backyard. It has to be in a registered cemetery, but ashes, there's more places you can put. Your third option is burial of the ashes in an individual plot at Woodlawn Cemetery, and there is a cost for the purchase of that plot. If the family does not want their baby cremated, if they want to bury the body, then they have the option to purchase an infant plot at Woodlawn Cemetery, and there is a cost to the family for that. So those are all the options within the partnership that we have with Saskatoon Funeral Home, and we categorize those options as hospital directed because it really is the hospital, it is us who are making these arrangements on behalf of the family, and Saskatoon Funeral Home is providing us this service. So that's how they want it classified. So we're going to call it hospital directed. Option B is any other service besides the Saskatoon Funeral Home. So that could be a funeral home in the patient's home community. We'll use the example of Lloydminster, and that could also be the option of the family transporting the body themselves. So if the family chooses another funeral home, we just document that funeral home, we contact them on behalf of the family. Whether or not there is a cost to the family, we don't know. That is out of our hands. There may or may not be a cost. If the family wants to transport the body, there is no further paperwork required if the birth classification is a miscarriage. If the birth classification is a stillbirth or live birth, there is additional paperwork that needs to be filled out. Again, this is to comply with provincial regulations that we bury human remains in a registered cemetery. So what does option A, hospital directed, look like on the after death logbook? If you go to the bottom half of the page, it says hospital directed. You're going to write the patient's name, the mother or father. They choose cremation, and then you're going to have to write in what they want done with the remains. So do they want to pick up the remains? Do they want them spread at Woodlawn Cemetery? Or also the option to not cremate the body is there as no cremation. So this is what option A looks like when it's completely filled out. You're going to write the funeral home, Saskatoon Funeral Home, and patient, parent, and registered nurse sign at the bottom. What does this look like when we're documenting on ISP? It's going to be the 3 blue lines that say hospital directed by a Saskatoon Funeral Home, and the phone number of the funeral home is right there. And it also says you need to fill out the cremation and interment authorization form. So what you do is check the box that the family has opted for. And if you drop down the arrow in the second column, it will tell you what to do with that form once you've filled it out. Option B, any other funeral home besides the Saskatoon Funeral Home. So we're going to call that family directed. What does this look like on the after death logbook? You are going to write the name of the funeral home under B, family directed, so Lloydminster Funeral Home, and if you could get the name of the person picking up the baby would be ideal. And then the parent and the registered nurse sign as well under, there's only one place for signatures, but make sure you're filling out option B. What does this look like on ISP? Family directed, any other funeral home besides the Saskatoon Funeral Home. In this case, we're using the example other funeral home to make all arrangements and write out Lloydminster Funeral Home in this case. If the family wishes to transport the baby themselves, that's absolutely fine. So there's no additional paperwork required if this birth classification was a miscarriage, they can just take the baby and go on their way. Um, if the birth is a stillbirth or live birth, then there's two ways we can handle this. Number one is they can contact a funeral home in their home community, and the funeral home will help them get the body buried in a registered cemetery. It involves the application of a burial permit. If they don't want to name a funeral home, then you just get them to fill out the form that is called release of body from a hospital to other than a funeral home. And all that is saying is that the family promises to follow the law when it comes to burying the body in a registered cemetery. And then they can transport the body by private vehicle. They also need to take the registration of stillbirth original form with them. What does this look like on ISP? If you go all the way down to the bottom, burial permit not required for miscarriage. So then they either name a funeral home or fill out the form 104459. When we're preparing to discharge our patient, make sure all of the left-hand side of this discharge tab is filled out because it is still a delivery, a discharge that needs to be documented what we've done for her, in particular her RH status and whether or not she needed Winrow. And then you're going to go over to the right-hand side and fill out the perinatal loss task checklist, as well as what the family has chosen for their disposition options. Once you are done your paperwork, you are going to get an educator, a coordinator, or the charge nurse to go through all your paperwork and make sure it is correct, and then they will double sign it off. We do have a lot of errors in this category, and it's hard to go back and fix an error in retrospect. It's easier if we check it over with someone on the front end and correct any mistakes before we send the paperwork everywhere it needs to go and before we send the patient home. So there's sort of two stages to sending a patient home. The first one is checking the paperwork. So you will see there's a place that says paperwork checked by, and that can be filled out before the baby has reached its final destination. Some of these other things, such as blood type, can also be filled out and needs to be checked before mom goes home. The rest of the section on the right-hand side is talking about interventions and investigations. So has the family requested an autopsy, CT scan, x-ray, yes or no? And are we waiting for those tests to come through? The thing we wait the longest for is an autopsy. And so if the baby is going for an autopsy, on the left-hand side of the after death logbook form, you're going to see a space where it says admitted to morgue, yes or no. And again, this is just a summary of everything we've done for this family and a paper trail of where's the baby and what needs to be done yet. So only when both the paperwork and the investigations are complete will there be a final sign off. At the very bottom of the after death logbook section here, that this family has indeed been, everything's been done for this family and we've done everything correctly and someone else has signed it off. When the funeral home comes, it is prudent to make sure that the person who they said was coming to pick up the baby is in fact the person who shows up. And so the way to do that is confirming the identity, and usually any person working for a funeral home will have an identification badge on them. So just check and make sure that they are in fact working for the funeral home that the family consented to giving their baby to. A couple additional steps when an autopsy is required. So the first thing, if we know the family is requesting an autopsy, we for sure will send the placenta. So on the surgical pathology rec, you are going to write fetus to follow in the notes, and that triggers the pathology department that they are going to keep the placenta and wait for the baby to come down, because they are going to want to examine the placenta and the fetus together to see if they can determine a cause of death. Really, the only time that the baby needs to go down to the morgue is when an autopsy is requested. It can take a couple days for the pathologist to get to these autopsies. And there is a cooler down in the morgue, so that's the primary reason why we take them down to the morgue to wait, because it keeps the body cold. Um, if the baby is going down to the morgue, then we need to document that we've admitted him to the morgue. We need to sign him into the morgue logbook. And then we take this after death logbook form and we put it in the binder in the charge nurse room to wait for the autopsy to be done. So we take the original autopsy consent to the morgue, but also a copy of this form. And if you see in the bolded box where it says interventions, investigations, it does have callback once completed, and that's for the pathologist to call back to the maternal care charge nurse to tell her that the autopsy has been completed. Once the autopsy is completed, the charge nurse can check that off, write the date and time that the autopsy was completed, and then look on this same page to the name of the funeral home, contact the funeral home to come pick up the baby. Another reminder that if we have any of these vital statistics forms, whether the stillbirth or the medical certificate of death, we are going to put a copy to the chart, but we are always make sure that these long forms, they're legal sized forms, follow the body out of the hospital, because that is what legitimizes the death, and that is what the funeral home needs in order to create a burial permit and get the baby to its final destination resting place.